I know that you have probably received a lot of information from your physician, but there may be some general information that I give to you today. But importantly, some of the things that I want to mention are things that you have to stick to when you go back home, which is you should record what you are eating. Please, I beg of you, that you keep a record of what you are eating. That is to say, your diet. In some cases, people say, okay, that's good for me, I will start eating, but you don't do it systematically, or you may focus too much on just that intake. And there's also a website which calculates the nutrition levels of your food intake, especially energy, protein, carb intake, and so forth. Vitamins and minerals can also be calculated through this website. So I'll give you some information about that later on. There are some other apps that will allow you to do the same thing. You might not be able to do everything, but at least you have a certain level of information, basic information that you can put in. And if you need help from a younger generation, whether it be your children or your grandchildren, please go ahead and ask for that support. But you have to start recording. That's the most important thing. Keep a record of what you eat. It's nice to get an average, so make sure to jot down at least 3 days worth of records. Because during the week and also during the weekends, you may have a different pattern of diet. So try to do 2 days during the week and then 1 day during the weekend. So it could be Monday, Friday, and Sunday, or something like that. So make an average out of the 3 days that you record. Jotting that down and recording it will allow you to confirm with your own eyes what your food intake is like. You probably have received education about nutrition, but as someone who is teaching nutrition and diet, I tend to be saying things that seem very generic, but these are the basics that will be important for you. Everyone has a different way of eating and a different diet. Some people have a high-fat diet. Some people have a high-sugar diet. Some people have a diet that is focused more on cold types of food, and there are all of these differences. It's not like one sheet of paper that says these are the foods that are good for you that will make you eat healthy. It has to be customized and personalized to yourself, and you're the one that knows the best. So before doing anything, please record your diet pattern. I'll be talking about 2 things basically. The first one is that all of this is for your health. And secondly, for those of you who have daughters, you may have full-grown adult daughters as well. But if, for example, you have teenage daughters, there are some things that you can consider to boost and improve her health situation. So I brought this in English. I understand that there may be some participants who are watching this online who are not in Korea, so I brought this in English as well. I have also some slides in Korean as well. But in any case, we all have to do our work on an evidence-based approach. We cannot recommend anything that is, for example, something that somebody heard said somewhere. So all scientists around the world are trying to focus on evidence-based information, and that's what I try to focus on as well. So all of that evidence being summarized into one area that can be found at the World Cancer Research Fund. So that's the summary that you can find there. Related to breast cancer survival, I'm sure that there was a lot of research conducted. Breast cancer in total and treatment of breast cancer tends to be a focus of a lot of research, but for breast cancer survival, there's actually a lot of areas that are left blank and missing. As you can see here, there's convincing and probable. But convincing side and probable side, it's left void here. What does that mean? That there's not enough strong evidence related to this, which is a shame. There are many researchers who are focusing on this area, but we don't have the research results yet. So previously, most of the research has been focused on breast cancer prevention or cancer prevention. But nowadays, breast cancer survival has greatly increased. So how to live through the survivorship in a positive manner and successfully, that's another area of research that needs to be conducted. Quality of life and long survivorship are important, so we have to focus on these areas of research, and it is what we are doing right now. However, we do not have, as of yet, strong evidence. Diet's important role is already being suggested in many studies. So it can increase the probability of survival, so that is very important. The American Cancer Society guidelines for breast cancer survivors, it's kind of actually very short. The first of which is getting to a healthy weight. Second, being physically active through exercises such as the ones we saw previously. And 3 is eating a healthy diet. And for eating a healthy diet, what's referred to here is diets high in vegetables, fruit, whole grains, chicken, and fish tend to live longer. So those are the more, let's say, recommended diets. But what should you stay away from? Refined sugars, fats, red meats, and processed meats like sausage and bacon and so forth. This doesn't seem very surprising at all, right? So far, no dietary supplement-related data can be found as a firm guideline. So that seems to be the current status. And I'll probably touch upon this later on regarding supplements. What you see here is American Institute for Cancer Research's recommendations. The AICR usually talks more about cancer prevention, and for cancer survivors, they recommend that you stick to these same guidelines in the beginning. So, a healthy weight, being physically active, eating a diet rich in whole grains, vegetables, fruits and beans, as well as soy products, and limiting the consumption of sugary drinks or fast foods or red meat, processed meat, and alcohol. Those are the things that are being suggested. And for supplements, it doesn't seem to have any specific benefits in terms of cancer prevention. So for cancer survivors, there's not a separate recommendation by the AICR yet. It's just simply to stick with cancer prevention-related recommendations. So it's mostly for education purposes. But of course, we have to fill in the blanks. We have to put some meat on those bones. So let me give you a couple of more tips. I cannot give you everything, but I'll give you a couple of tips. First of all, related to maintaining a healthy weight. This means you shouldn't be too thin or you shouldn't be too overweight, but so for obesity, as you have probably heard and you probably know that BMI 25 or greater is defined as obesity. But it doesn't mean that if you have BMI 26 that you should be devastated. No, that's not the case. You can definitely be healthy that way. But if you continue to gain weight, that would be a problem. 25 or 26, it really doesn't make that much of a big difference, and you shouldn't feel too guilty because of that. And for BMI, how you calculate that is using the units of kilogram for weight and meters for your height. So if you're 160 centimeters tall, then you can be 1.6 meter, and you have to divide it actually twice. So if you're 60 kilometers in weight and you have a height of 1.6 meters, you divide 60 by 1.6 by 1.6 once again, so it comes to 23.4. So in this case, the BMI is 23.4, which is not too bad. So you can continue with the habit or the diet that you have maintained so far, but I'm sure your physician will say, well, it's not bad, but it will be better if you can reduce your weight. And the first step in doing that is to reduce the level of food intake. Because everything is decided by how much you take in terms of food and how much you move to consume that energy. So make sure that you jot down, as I mentioned earlier, record everything that you consume as food intake. And you can do this by going into Food Safety Korea. You can simply search it either in Google or in Naver. And the FDA of Korea has established this website. In the beginning, they didn't have a lot of interest nor effort in dealing with food safety, but now they're doing a lot of work, especially this website with information about nutrition, information and so forth. Nowadays, they do a really, really good job, so you should make full use of that. And it's becoming updated every single day. Even one special brand of yogurt, they tell you what the nutritional information related to that is, and any snacks that you see in the grocery store, many of them have already been included into their database. I think if you have Samsung mobile phones, they have an app already installed, and it makes it possible for you to easily identify the energy levels that you are intaking with carbs, protein, and fat. There are other more detailed smartphone applications that deal with diet as well. But in any case, at least for energy, carbohydrates, protein, and fat, you can make use of these tools to definitely identify how much you are taking in. Let's take an example. Remember the Food Safety Korea website that I mentioned? You go in here, and for breakfast, let's say you had a slice of toast and a cup of coffee, and you had some snacks, and then you had the lunch and dinner. Then you are able to identify how many calories of food intake you have had. Let's say you are, for example, intaking 1,700 kilocalories every day on average, then that means that you just maintain it that way and there won't be a great increase in your weight. However, if you go up, let's say 300 kilocalories or 500 kilocalories further, if your food intake is a bit high, then you will probably gain weight. Of course, there may be some days when you eat a little bit more than other days, but that will even out. But if you have a continuous and steady increase in food intake, and then of course it will have an impact on the weight. Many people take nuts as a healthy snack, and they are healthy. Whether it be internationally or in Korea, many studies have shown that nuts have very good benefits. And in the case of Western countries, replacing unsaturated fatty acids, they suggest more nut intake. But in the case of Korea, we have a lot of things that you are taking in that can take the place of nuts. So if you simply eat a lot of nuts, that becomes additional fat. Of course, it is good in terms of the monounsaturated fatty acids that it provides and the minerals, but the problem is that they are high in calorie. Let's say you have this little bowl of nuts, it's already 100 kilocalories. So if you eat your meal, like a bowl of rice with all the other side dishes, and then have a handful of nuts, then that's even more calories. After doing a diet evaluation, I give some feedback. Some people say that sesame powder is good for you. They heard it somewhere. They heard it from somebody, and they would put in 3 tablespoons into a juice or a mixed drink that they make. And that's already 240 calories per 50 grams. So that means an additional 240 calories for something that you believe is just going to help you become more healthy. So no, even if it's something that is good for you, remember that it's additional calories. Go back to that website that I mentioned earlier, and then you put all that information in. And then you'll be able to see whether it's a high-calorie product intake or if it's a lower-calorie intake. So, and then you adjust accordingly. So this is an example. This patient had 2,296 calories, but she should actually be at 1,700 calories. So she would be gaining weight with this because she ate a lot of yogurt with nuts 3 times a day. And then she also fried some nuts as snacks because she thought that it was healthy snacks. So she would put a lot of them in the yogurt that she eats as well as in other foods. So the calorie increase was obviously visible, and also the fat intake rate was quite high. It's recommended that it's at around 15%, but her fat intake was 43%, which is very, very high. It's almost like Western people. So unsaturated fat is good, but this much intake is actually going to make you go overweight. So as you can see, she ate a lot of nuts additionally to her existing diet and food, so that's going to make her increase in terms of weight. For saturated fat intake, of course, lesser is better. I listened to some of the international speakers who were making their presentations yesterday and the day before, and the more recent studies are showing once again that saturated fat intake is actually negative for breast cancer. The diet on the left-hand side has saturated fat intake taking up 6.3% of total calories, and on the right-hand side, the diet on the right-hand side, the saturated fat intake is 5.4. And also, if you look at the items that are included in that diet, there are many vegetables, and it's a lot of work, but it seems like this seems to be a more healthier diet. Of course, if the side dishes for your meals are a bit too salty, then that would be a bit problematic. So there should be some efforts to lower the sodium intake levels. You could dilute it out with water or other types of ingredients in order to make it less salty. On the left-hand side, if you eat fried chicken, for example, then saturated fat intake is going to increase, of course. Now, fat intake should take up about 7% of the total calorific intake, but here we see it's already at 10.5. So it means that people think that it's good for you, so you concentrate a bigger part of your diet in these areas. So what is important is to have a balanced diet. If you have a focus or concentration in certain type of food, then that is actually not good. You could have pork one day, pork belly one day because you're eating it with your family. I mean, that's fine. I'm not saying that you should never, ever eat pork belly. If it's once a month with your family, then that's fine. And then afterwards, you can have some more healthy food for the rest of the week. Or what I'm saying is that it shouldn't be too concentrated onto one item. Another thing that is dangerous is sugar. In Korea, these are the main sources of sugar. Carbonated drinks, coffee, apples, milk, and yogurt. There's a lot of sugar-added yogurt out there in the market. So take a look at this. You'll be able to see how much sugar is included in there. If you go to the supermarket, for example, there are a lot of brands of yogurt. Look at how much sugar is inside. And many types of breads have a lot of sugar included in them. So you have to reduce the sugar intake. That will increase the calories, and also for refined carbs, it's definitely not good for you. For fruit, fresh fruit is much better in terms of intake. If you make all the fruit into a juice, then the fiber is eliminated. In that case, what happens is that your blood sugar level goes up, but you don't benefit from the fiber because it's all destroyed when you put it in the mixer. So try to eat fresh fruit without processing it or making it into a juice. Many Koreans suffer from calcium deficiency. So I'll actually talk about this a little bit further, but make sure just because you think that you lack this, if you go overboard, then that's actually not good either. And vitamin D, it's a nutrient that is difficult to intake from foods. So you can go out, or you can also get some prescriptions. If you are taking some prescription vitamin D plus supplements, make sure it doesn't go overboard either. So the foodsafetykorea.go.kr FCDB will allow you to see what is included in the database, and they have a lot in their database about the nutritional values in many different types of food. For example, if you enter cream soup and search for it, there will be many that pop up. If you can find the one that you have purchased, then that's great. If not, find something that is similar, and you'll be able to identify the nutritional values. I mentioned about supplements, and I'm running out of time, I'm sorry. So if you take in this many supplement, then you're all the way up to 200, which is like the maximum. It may not seem like a lot, but that's actually a lot of calcium. You should actually be limited to about 800 milligrams daily and not all the way up to 2,000. Meat intake, as you're well aware, try to stay away from charcoal grill types of meats and try to reduce meat intake as much as you can. Now, moving on to the second part, as I mentioned earlier, about for your daughter's health. It's more relevant if you have, for example, teenage daughters, if you're thinking more about prevention. When the breasts are becoming developed and becoming mature. If you're thinking about your teenage daughter or your granddaughters, a healthy diet will definitely be helpful for prevention. Especially if your daughters and granddaughters go to, for example, college or become that age, then they will start alcohol consumption. So that's something that you need to be aware of as well. Go to the same website that I mentioned earlier. There's a lot of information, so you might be overwhelmed, but I think it's very important to take note of all of that information that's there and make sure it's balanced. Increase your physical activity, avoid sugars. Those are basic general rules. But all of you have different characteristics, so try to go see a nutritionist and see what your personal situation is. And in order to have that consultation, record what you eat. And if your daughter has a bad dietary habit, then try to improve it from this point onward. Thank you for your attention.